morning at NTV, and we're live from Kampala's Fana Conference Center. I'm Andrew Chamagero Muntuwa, and see the conversations on the ground. I will still say we need to go get vaccinated. Teachers, only 14.9% have been vaccinated. Come on, people. Let's go get vaccinated. And as we're getting closer to the Global Hand Washing Day, we want to talk about this and more. We have Mr. Akoye Martin, a Senior Environmental Health Officer from the Ministry of Water and Environment, and Ms. Kawesa Mariam, the Assistant Programs Officer from the Agriculture and Water in the Environment Sector, that is a JICA. This conversation is online. The hashtag is Morning at NTV. We'll pick your feedback there as and when it happens. Good morning, boss. Good to see you.
Good to see you.
You got vaccinated?
I did.
Mariam, did you go for the vaccination?
I did.
Both jabs?
No, I've only gotten one.
We need to go for another one. How long do you have to go for the other one?
I plan to have the next one in November.
November.
Around the 14th.
That's good. That's good. We are having this conversation because we need to get this moving fast and forward. But I want to talk to you, if I can start with you, Martin. Let's talk about the global hand washing conversation. Why is it a conversation we need to be interested in as Ugandans?
Okay. Thank you so much, Andrew. I want to say I'm humbled to be part of this TV talk show. To get to the Global Hand Washing Day, in 2008, the UN Assembly did resolve that every 15th of October, we celebrate the Global Hand Washing Day. And this was premised on the fact that hand hygiene across the globe is trivialized. And so they thought it was wise for us to have that day designated for us to shine a spotlight on the benefits that accrue from hand washing. And many of us who have been in the circles of sanitation and hygiene can attest to the fact that when one washes their hands with water and soap, they go a great mile in regard to reducing the occurrence of diseases in the community. And largely the diseases that we have in the community that are attributed to hand hygiene are the diarrheal diseases. We have intestinal helminthes, people suffering from worms. So we find that hand hygiene is a cheap and an effective way of how we can reduce the disease burden that we have in the country.
As a country? As a country, yes. Mariam, when you look at the theme this year, what's the theme this year, and how best can we tap into the theme of this year to expedite this conversation of hand washing?
Thank you, Andrew, for having us. The theme this year is the future is at hand. So I think we have a big responsibility as Ugandans to ensure that we take on hand washing practice as a main way of controlling disease and the spread of COVID. So I think as JICA, we happen to have a number of interventions, but we think providing hand washing facilities or bringing these services closer to our people, to our local folks, to ensure that we sensitize them on disease control and the spread of COVID. I still believe it's a good venture for us.
So, Mariam, when you go in the field and when you're extending the services, I really want to thank JICA for that, extending these services to the person at the bottom of the pyramid. While you're there, what are some of the hindrances to this conversation? Is it something to do with the culture? Is it something to do with religion? Is it just adamant behavioral, restraints?
Well, there are a number of factors, I would say, like you mentioned, Andrew. They cut across. We're looking at behavior, you're looking at mindset of our people, and then you're looking at how best can you improve or how best can you bring them closer on board, to understand the cause for all this. Yes, like you mentioned, there are a number of factors that we're looking at. One, from teaching them on how to hand wash, you look at household level and then bring it closer to the district or the leadership. So sensitizing them and then ensuring that they take on this activity to spread it to schools and the environment around them.
Now, Martin, given that schools are now closed, churches are operating with 200 capacity. When we come to this conversation, what models are you using to cascade this information to the locals, given that they no longer congregate as they used to come in the town halls previously for these kind of conversations?
All right, thank you so much, Andrew. As Minister of Water and Environment, and as the National Handwashing Secretariat, what we are doing to reach out to the masses in regard to passing on the message of hand hygiene is that we are working with the media, we are here today. We are trying to use the different social media platforms that there are, and then we're also trying to engage on radio, on TV, where we don't have to interact with the population physically.
Okay.
So that's how we are reaching out to the population with the messages that are geared towards changing their attitude.
That is good. Let's talk about you in your statements earlier on, you alluded to the word clean water and soap. When you go to the rural areas where I reside in the countryside with my Handwashing, when you go to the pit latrine, there is a jerrycan with water. There is no soap. So how do we engage that? How do we make sure that it's affordable, the soap is affordable for the wananchi, that they can use it, and the behavior that even when the bar goes down, we can still replace it easily?
Okay. All right, thank you so much, Andrew. There's a formative study that was conducted, and it informed that 95% of the Ugandans can afford soap.
Okay.
So literally, it's not about the issue of not having soap. It's the willingness to have soap put at that place, and then people are able to wash their hands. So as the stakeholders that are involved in the business of hand hygiene, we still have a lot to do to continue engaging the masses, trying to sensitize them, trying to change their attitude, and trying to have that buy-in from the community so that they can willingly buy the soap and have it placed at the place where they're supposed to be washing their hands. So we have to engage the household heads, the literally the men, because they're the decision makers at a household.
Yes. So
we have to engage these men, and oftentimes when we have our meetings in the gatherings that we have, it's only the ladies who turn up. They're in the trading centers, they're in bars, and yet they're the ones who take decisions at household level.
Oh, yes.
So we should implore them to come and be part of that conversation so that we can have soap availed for people to be able to wash their hands.
That makes a lot of sense, Martin. When you say that, men, we need to be a part of this conversation. We should not leave this to only the women. We need to be a part of it. Mariam, JICA during the COVID-19, the very first pandemic, we ran stories here where we saw JICA came in with a lot of proportion supporting the fight against COVID-19 with hand washing facilities, sanitation issues and all that. How are you addressing the issue of inclusion? Because under the SDGs, you're saying we're not leaving anyone behind. Here we are drumming the drums for hand washing. What is JICA doing about the inclusion aspect of the people with disabilities, people with impairments? How are we addressing it with regards to the hand washing campaigns?
Thank you, Andrew. The magnitude of intrusion or inclusion is quite bigger. But as JICA, we look at all approaches or any strategies that we ensure that we include everyone, involve everyone, how with the help of the Ministry of Water and Environment and our district leadership, our district local government has been involved. So from that level, we ensure that from the level of the district, we engage them. Is having community meetings with our people in the communities. Is to ensure that we create awareness through radio broadcasting, adverts, and we engage our people on radio or community radios going around the villages to ensure that they pass on the message to the lowest grassroots folk.
Well, JICA is being very careful to give me the response. Now, Martin, you're the government here. How are we addressing the issue of inclusion, especially for the young girls who are disabled or the elderly at the village level? I'm going back to the village level because that's the core we need to address. What is government doing about this issue of inclusion with hand washing?
All right, thank you so much, Andrew. On the issue of inclusion, as we do the programming for WASH, to be particular in relation to hand hygiene, we try to address the aspects of the different segments of the population. When you talk about the PWDs, you talk about the elderly.
Yep.
So we try to cater for all those as we are planning. But to nail it, I can say that we have a research arm in Mukono, that is the Appropriate Technology Center of Ministry of Water and Environment. So as we come up with the technologies on hand hygiene, we try to factor in the aspect of inclusion. We come up with facilities that can address the interests of the different segments of the population. For example, we have this the touch-free facilities where we use the pedal.
Yeah.
So that one is very easy for someone who's disabled to use it. They can step on the pedal and they're able to wash their hands.
Now, I have an issue again with the pedal. For someone with a disability, yes, they can step on it and they wash their hands. But again, when it gets to the children with height, are we addressing that as well?
Yes, I can say that to a greater extent we're addressing that as well. We have facilities that are meant for the children to use.
Okay.
Like when you go to the villages, we have those tippy taps. Those are the popular facilities that we have across the country, where we have there's a stick and a string plus a jerry can. So it's very easy for a child when they visit a latrine to come out of that latrine and they're able to wash their hands with the tippy tap technology. Okay.
Let's talk about you wanted to supplement on that? Carry on.
Yes. Thank you, Andrew, and thank you, Martin. If I'm to supplement, as JICA, we've worked with the local communities to come up with technologies that can suit their kind of
appropriate technology.
Yes.
Nice.
With our ongoing project, we've had a particular one that we call Sunda, where the hand pump has a token and you just have to insert the token. So with disabilities,
so do we have someone there managing the tokens?
Yes, we have the caretakers.
That's nice.
And this is the local community that has to take care of their particular work.
I think I love that.
Yeah.
That addresses the issue of our inclusion. I was very worried when it gets to that. Martin, let's talk about the access to clean water. What is the percentage of the Minister of Water and Environment with regards to access to clean water? There are places even within Kampala or just not far from Kampala. An example like Kachiri, where people still have to walk big kilometers to access water. And I think this becomes one of the impediments whereby they will say, and this goes against the agenda we're trying to achieve here.
All right. Thank you so much, Andrew. Absolutely, I agree with you that we are still grappling with the issue of water supply across the country. But for the statistics, I can say that for rural, we are at 68%.
That's a good mileage.
Yeah, so we have like 32% of the population having access to safe and clean water. Then in urban areas, our coverage is at 71%.
Okay.
So we have a small segment of around 29% of the urban population not having access to safe and clean water. But I can say that as Ministry of Water and Environment, we have plans to shorten the walking distance and also reducing the queuing at the water points. And what we're trying to do, we are trying to come up with the solar-powered systems where we have high-yielding boreholes, motorized, then we have a network of pipes.
In the locality.
So that we distribute this water and bring it closer to the population.
The people.
Yeah, to the population.
Talking about that, when I visited your offices a few months ago, there is the technology I saw at the entrance. Yes. It's blue in color. What is that technology called? It's
called the washer-load.
Washer-load.
Yes. How
do we take it to the villages? Does it have to be solar? Is it a spring? Is it pressured? Because it's user-friendly from my lenses to the villages.
Yeah.
How do we make it more available to more people out there?
All right, thank you so much, Andrew. That washer-load technology that we have at the ministry, right now we are having that around Kampala.
Okay.
It's GIZ that is working around that washer-load facility.
Okay.
It requires us to have constant water supply running through the system. And also what can stop the rural population from having access to such a facility is the cost.
Okay.
So we are trying to work around with the private sector. That is like we have Gentex, we have Crest tanks, people are manufacturing those materials that are required for us to have that washer-load.
Okay.
So we're having an engagement so that we can bring the cost down.
Wow.
Which then will be affordable to the rural population. But currently, it's a bit high.
It's a bit high.
Yeah.
Well, I love it. And if you're one of those locals watching this program, well, go on to the website of the Ministry of Water and Environment, and you'll acquaint yourself with more of this technology and how we can apply it in our areas. Mariam, what are the critical hand washing points we need to take as Ugandans as we're getting closer to this day?
Thank you, Andrew. I would say to our countrymen and listeners that
You've really been watching the president. I love that.
thank you so much. I would still continue appealing to our people that ensure to be vigilant and wash your hands. Ensure that it's not only washing hands with water, but apply soap to the activity. Ensure that you apply soap and then wash hands properly. And to any point, whether you're going to the toilet, whether you're going to eat food, or even before eating food, ensure that you wash your hands, and even after the activity. Then I still think that it's still a period that we are not sure of when it is ending. So I still think it's a continuous activity that we need to take on, until I think it should be part of us.
It should be a routine. It should be a habit.
It should be, it should be a habit to us.
Martin, when we talk about washing, there is something she has alluded to about washing hands, and she's very passionate about it. Scientifically, from a technical view, how long should someone wash their hands?
Thank you, Andrew.
Like if I start...
Yeah, if you start washing your hands, literally it should be taking you like 20 seconds to be done with your hand washing.
Nice.
Yes. But oftentimes what happens is that when some of us visit those hand washing facilities, we only wet our hands. We just do this.
Yeah, I've seen that. That's why.
And then we walk away.
So, countrymen, the 20 seconds to bring it closer to your perspective, hum one stanza of our national anthem. That is 20 seconds. Just hum it. While you're humming, until when the stanza gets done, then you can move forward. I think that's the 20 seconds to go with. Then I'm looking at Mariam, now that you're here and you're working with JICA, how can the different stakeholders be a part of this conversation? JICA, you're doing an incredible work on the ground, but you can't do it all. How can we be a part of these conversations as citizens?
Thank you, Andrew. I still think this is something that is not only for the water sector or particular stakeholders as donors or particular institutions like the Ministry of Water. So I think it's a worldwide issue that we all need to take on, not only in terms of financials, but I think any kind of resource that can be earmarked for this particular campaign. So it is my appeal to our people out there and to our listeners that we need to take on this, not only as JICA coming in or any other donor coming in, but I think it is an issue that we all need to come together and as a center stage to take on this together to build our country or our nation.
Martin, you can broaden this more when it gets to stakeholders. There is the political will, but when we go to, I loved where you started from the family unit. How do we propel it from that level to the national level? What are our roles? What's our call to action as Ugandans?
Thank you so much, moderator. We have an array of stakeholders that have a stake when it comes to hand hygiene. We have the politicians, we have government, which entails a number of stakeholders as well. In government, we have the technocrats, then we have the politicians. So all these parties have a stake when it comes to hand hygiene. When it comes to appropriation of resources, we have to have government come in together with the expertise that is to be offered by the technical people like we who are here. To support that cause of hand hygiene. Then we have the private sector. We have companies like Mukwano who make the soap. We have Gentex who deal in PVC. Then we have Crest Tanks. We've tried as the technocrats and government to engage the different private sector members so that we have the services and products available. These have to be at the disposal of the community if we are to achieve our target of universal access to hand hygiene.
Now that brings me to the challenges. What challenges are you facing as a ministry in, you know, pushing this agenda? From the funding, like she mentioned, the funding seems to be the big challenge there. But what other challenges could possibly go without any noise, and we need to highlight them?
That's fantastic. As the ministry and the secretariat at large and the different stakeholders that trade in the business of hand hygiene, we have a number of challenges. One is financing. Oftentimes when you engage there would be funders for hand hygiene. They don't take it as something that is very serious. It's always trivialized, and very few people are willing to inject in money so that we see the habit of hand hygiene being embraced by the population. But I want to say thank you to UNICEF. UNICEF all the years has supported the National Handwashing Secretariat with funding. So most of the activities that we do as a secretariat are being facilitated by UNICEF. So we are saying thank you to UNICEF, and we also call upon the other partners. We've worked with IRC, Water for People, we have JICA. So we have a number of partners that we are working with. Then I want to get to the researchers. We have, like I said, we have a center in Mukono that is basically doing research. We have Makerere, we have a number of institutions. So I implore all of them to do more research. That is
on innovative ways how we can cascade this down.
Of how we can.
Wow, I love that. JICA, I don't want to put you at the spot, but you've invested a lot of money in hand washing.
Sure.
Do you want to give us a figure? Can you give us a figure?
I would say it's a generous amount.
It's a generous amount. Oh, okay. Then I want to know, what other projects or plans does JICA have that are going to run in tandem with the hand washing campaigns going forward?
Thank you, Andrew. I would say at the moment we have a number of interventions in the pipeline. Well, I won't unveil all of it, but I would say there is a number. We'll keep launching. Well,
I wanted to tap into it and see if we can, you know, get the information first and be ready.
But as you're aware, there are a number of course, ongoing ones that we have with the operation and maintenance projects in Mubende, our very own in Central Region. But I would say there are a number that are coming through the pipeline.
This conversation can go on and on, but just so you know, if you want to know what JICA is doing, log on to the website, look for JICA, and you'll get to know what is happening. As we're finalizing this conversation, Martin, what are some of the key activities that are going to happen as we're celebrating the Hand Washing Day? Previously, we would march, every district would do something, and we would be in the refugee camps and all this with the aspect of inclusion, and everyone was doing something about the hand washing. And research shows that our numbers have gone low after people came out of the lockdown. People are no longer washing so much. Now, what activities are we going to have this time around as we're celebrating the Global Hand Washing Day?
Okay. Thank you so much, Andrew. What I can say about the activities that have been lined up for the Global Hand Washing Day, for the past 2 weeks, we've been having a number of activities, like the one we're having right now. We've had media engagement on radio, on TV, trying to reach out to the masses and trying to pass on the message of hand hygiene. What are the benefits that can arise when one washes their hands? And over the years, we've been having this done rotationally per region. We've had it in Karamoja, we're in Napak. We had it in Central, we're in Luero. We had it in Northern Uganda, where we're in Omoro. Then we had it in Kamwenge. But because of COVID, now we are unable to have such events where we have gatherings. Now we are going to have it. It will be a virtual celebration. We will be streaming it live on TV. Then we will be having a few participants at the Ministry of Water and Environment headquarters. The occasion will be graced by Her Excellency, the Vice President of Uganda, Honorable Jessica Alupo.
I love that. But what should I do when you people are talking, while you're talking at the symposium? We're going to be talking very big languages, policies and framework. What is my call to action as a Ugandan on the 15th? What should I do in my community to amplify this conversation?
Thank you, Andrew. What you're going to do as an individual in your community, we're asking you to be exemplary.
How?
As you're in your community, try to demonstrate that the aspect of hand hygiene is very key when it comes to prevention of diseases in the community. Some of us leaders, when we're in the community, we don't act as we're expected. You find you're having a gathering, you're addressing people, and then it comes to time we're going to have a meal or a bite, and you're not washing your hands. You just walk and you're going to pick something to eat. Oh yeah. Then even in our households, let's try to teach our children that the aspect of hand hygiene is very paramount when it comes to prevention of disease. Research has it that children are they are the best change agents in the community. And once they take on a particular habit, they always carry it on. So we are also imploring the schools, when we open up, let's try to impart this knowledge to the young generation so that when they grow up, they can take it up. Because the Baganda is it say echacha mamamera. So when someone is of age,
they cannot change so fast. Well, Jaika, as we're finalizing this conversation, Mariam, what are your parting shots to the local leaders, to the government, and to Ugandans at large as we're getting closer to the day?
Thank you, Andrew. To our fellow Ugandans, it's our continued appeal that we stay vigilant on observing the SOPs in spreading the COVID-19. Yes, as we are all aware that the period is not ending now, but let us continue washing our hands. And not only washing our hands, but please ensure to keep your hands away from your face, your mouth, and also wear a mask everywhere you go. And then to our leadership, that is to the district and the government, it is still our urge, or we still appeal to you that ensure to take on responsibility for the support we've provided, and then we still think the knowledge that they've acquired from JICA's activities or from the experiences they've gotten, the good practices, can then please take them on to the next level, to a national level, as we build our nation.
Well, there you have it. The conversation is already going on. 15th of October 2021, we'll be celebrating the International Global Hand Washing Day. I can't tell you better enough. I will tell you, go for the vaccination, but make sure that the habit of hand washing becomes part and parcel of you every other day. The same way you love to brush your teeth, make sure you have the same kind of consistency when you're washing your hands, whenever you're touching surfaces, before and after you've eaten something, and after shaking hands. I've seen you people shaking hands even with COVID here. You've started shaking hands. Acquaint yourself with the habit of hand washing, then we can fight against some diseases, and when we fight against them, the benefits are you save a lot of money. It's Mongaden TV. I'll take a break for now and I'll return shortly.